Hi guys, it's Sheena from Teton Raptor Center and I'm here to give you all this week's patient update, so let's go ahead and get started. First up this week is Northern Saw-Whet Owl 4-1, and this bird came from Idaho with head trauma and eye trauma to the left eye. Right now he's on a course of medicated eye drops that he receives 3 times a day. You can see in this photo right here, this is right after he got those eye drops, so his eye is a little bit squinty as you can see, but we do suspect that this will improve over time. Moving right along, next up we've got Great Horned Owl 330. This bird came to us from Green River, Wyoming and was unfortunately illegally shot. The bullet is still inside of the bird. That's because it is located really close to his neck, right by his trachea, and some other really sensitive parts of the bird. And in this particular case, it would be more invasive and intrusive to remove the bullet than it would to just let everything heal with the bullet still inside of the bird. So we do believe that we can release this bird. However, he will keep that bullet in his shoulder for the rest of his life. You can see in this image here where the bullet landed. So it's that bright glowing object right next to his neck. And unfortunately, it did break his coracoid. However, that is a bone that heals really well with just cage rest and some physical therapy. So we do believe that he will be able to fly again. He's in great spirits, he's feisty and alert, and so those are both things we definitely want to see in our patients. He is still going to remain in the ICU for another couple of weeks because we don't want him flying around on that injured wing until it's a little bit more healed. Next up, we've got Golden Eagle 313. This is the bird that came in with a ruptured crop. You can see that nice pink skin under there. Things are healing up really nicely, so that's exactly what we were hoping to see. Additionally, this bird has a really great appetite, so that means that it's definitely comfortable for him to continue eating, even with that injury to his crop. And we do believe that this bird will make a full recovery. Right now, he has moved into a larger enclosure in the PCU, and he's got more perching options so he can get up a little bit higher and move around a little bit more now that he's not confined to a smaller space where we wanted him to be a little bit more still and sedentary during the healing process. Next up is Golden Eagle 3-9, and this is the bird with a metacarpus injury to his right wing and some feather damage to his right wing. He is healing up really nicely, and here you can see him in his PCU enclosure with some nice sunlight streaming in on him. We're getting him out about every other day to every 2 days for physical therapy and cold laser therapy, and things are going really well so far. You can see he's standing up really nicely on that T-perch in his big enclosure, and we're hoping to move him to the flight barn in about a week. Last but not least is one of our most popular birds among all of you viewers. This is Bald Eagle 2-4. This is the bird that was illegally shot in her wing, and here we are doing physical therapy on that wing while the bird is under anesthesia. So we use anesthesia because a lot of these stretches can be quite painful for these birds, and so having them be able to be asleep and fully sedated allows that stretching to take place without causing them any significant pain, because of course that area is already going to be a little bit tender. So right now we've got a mask over the bird's beak, and what that does is it's delivering anesthetic gases along with oxygen so that the bird is comfortably asleep. You can see that her eyes are pretty much closed. The reason that one of the eyes in frame looks a little bit open is because sometimes even though a bird is fully asleep, their eyelids can be slightly opened. And so this bird is definitely fully asleep. We're not doing anything that would cause her pain. She is comfortable on the table, but that is why you see that eye open. So here we are just doing some stretches. Right now in this video, I'm working on opening up that wrist and making sure that we can eventually get full range of motion in that wrist. Another few things that we do while the bird is sedated on the table is check any of the soft tissue damage sites that had some injuries when she first came in. We're making sure that all of those soft tissue injuries have healed properly. We're also still doing some cold laser therapy in some of the more sensitive areas, especially because this bird had fragmented pieces of the bullet, both in the muscle by her shoulder as well as in her hand. So it's a lot of different small fragments of lead that we want to make sure are not causing her any issues or any pain and discomfort. I also thought it would be interesting for you guys to see how we wake these birds up. So first, that mask comes completely off the bird, and we actually go over to our anesthesia system and flush out any of the gas that's in there. So all of that gas gets let out of the mask and out of the tubing apparatus. And then once everything is completely flushed, we'll actually put that mask back on the bird's beak. And now all that's coming through there is just straight oxygen. So that will help wake her up. So there's no gases going through, just fresh air. And then we also can deliver a medication that we inject into the muscle that reverses any of the pre-med drugs that we provided her before anesthesia to help her go to sleep faster. All right, that's all we've got for this week. Thank you guys so much for tuning in, and I hope you enjoyed learning more about our birds. Remember that you can do your part to help keep wild birds wild by checking out our website at tetonraptorcenter.org and making a donation. Bye!